Hello everyone, welcome to the mental health, mental illness and traumatic brain injury module of mandatory training for NDIs. And this training is very important when you are working as a disability support worker for any organization. I will go to the next slide, which says that I would just want to know from everyone, what is mental health? Will you define mental health? Well, mental health is something which is an integral and essential component and is also defined as an absence of mental illness. Means if you are sound and you can understand everything and you feel it means you are healthy by your mind. And what WHO says about mental health is an integral and essential component of health. Why? Because it controls the whole body. Health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Why a person may get a mental health problem? That's a big question today. It can be a brain injury which can develop a mental illness, and if you see the data says that 42% of people with brain injury have a mental health illness. So mental health illness can be in lot of people, but today since we are talking about brain injury and any other mental health illness, so we will be focusing around that. Factors which affect anybody's mental health are biological, psychological and social. So I will just give you a few seconds to think of anybody around you who you feel might have that, and what are the factors which comes into biological, psychological or social environment. And it's very important to understand why mental health problems occur after traumatic brain injury, and also what factors are related to it, its ability to recover, then health risk, stress involved and legal risk. The brain and mental health problems. Researchers believe that change in size or shape of different parts of brain may be responsible for causing some mental illness. Because lot of times when brain injury happens, it happens with what happens. There are certain parts of the brain which get affected. There are different surgeries going on, and it affects the cognitive ability of any person to comprehend to certain situations around them. And connection between nerve cells along circuits and brain can lead to the problems as well. So what are the types of mental health problems after a brain injury? So primary, it is depression, anxiety or stress, and it can also lead to suicide and self-harm behavior. What is depression? Depression is a mood state apart from negative thoughts and emotions. Common signs can include common signs which you can see is that people can be isolated, they will not connect to anyone, they will not like to talk to anyone, they might get suspicious about you talking about them. So there are different things. And what are signs of depression? Just say reduce attention to physical appearance, means they don't want to shower, they will not wear good clothes, or they will not take any interest on these kind of withdrawal or loss of interest in formally enjoyed activities, improper sleep, appetite changes, not feeling very hungry or might be eating junk food, tiredness, and ability to perform everyday tasks, decline in ability to cope with everyday stress, increase irritation, anger, getting frustrated in small things, agitated by small things by family members or support workers around them. And diagnosis by a clinical depression means a professional can help and treat, and they can work around the different signs, and then they can put in strategies. Doctors can provide referrals to specialists like psychiatrists or psychologists, and it's often case when it is diagnosed, it is always easier to treat. How to cope with this what are the coping strategies for depression is adequate sleep, listen to music, socialize with friends, avoiding alcohol and drugs, and work on personal body project or hobby like having exercises, going to gym, having a proper healthy diet 3 times a day or 4 times a day, whatever, and having good food and healthy food, and always having a positive self talk, and having a confidence development of I can manage this. Suicide, depression, and brain injury. A suicide attempt is rarely made following a sudden or impulsive decision. It is common for individuals between initial thoughts about suicide and actually committing it, and there is a thin line between it. The patient will never understand or never will be able to judge that when they move from initial thoughts of suicide to committing a suicide. Some may even engage in self-harming behavior like harming themselves in they can do any harm to themselves by using some sharp objects or by burning or any other things, and they may lose hope in any sort of activities in life. What as a support worker you should look for? First of all, you should always listen carefully to the person who you are working with. When they say it would have been better if I had died, so that means they are depressed, they have that kind of understanding where they have lost all the hope in life, or they are becoming withdrawn from families, from everyone. They even say to you, I don't want you here, I want to live alone myself. And so sometimes it can be a sign as well that when somebody you feel is in depression and suddenly they become cheerful, can be an indication that now they are thinking that they have to commit suicide, and if a person has tried to commit a suicide before. So fatigue problems and inacting. So fatigue is one of the main criteria used when diagnosis depression. So it's not exactly that everybody will have the same thing, but it can be a reason. And what can be the reasons of having fatigue, developing fatigue? Anxiety, depression, reduced stamina, pain, and physical difficulties. So don't go and say to the client where you are working with, oh, you are lazy and that kind of sentences, you don't want to work. Just always motivate them. Always talk to them how good it is for their health. A short walk, a long walk, working in the backyard, doing some lawn mowing, engaging in gardening activities or cooking activities, cleaning the house. So you are a support worker, you're there to support, but it's also important for them to be included, because it helps them to feel that they feel that they are important, and they still have some use in their life. So factors factors that develop fatigue are cognitive difficulties, because they are not able to judge cognitively different things which they were previously able to, and they lose the sensation at certain level, poor diet, adjustment to changes in their lives, and also the environment. What are the signs? You will see that they will yawn, they will lose concentration, fuzzy head, and fidgeting, getting irritation, limbs feeling heavy, stomach feeling sick, and also the biggest thing is lack of motivation or interest to do anything, even the things which they like the most. Managing fatigue, always create a routine for them like rest periods, and have an uncluttered environment, clean and always fresh and good bed sheets. When they are in the lounge room, environment should be clean and active, lively. Strategies to do so: always follow a healthy lifestyle, means plan a healthy lifestyle, and give plenty of sleep, avoiding or limiting alcohol, healthy diet, and especially planning your time is very important. Create a kind of organizer for them, and you always take their feedback, always involve them, always ask them what they like to do, what they not like to do. If they are saying they don't like to do anything, just encourage them and tell them the importance of why it is important for them. And yes, because we all are not professionals, so we need to get in professional help. So any suicidal comments need to be addressed, need to be reported, and have a plan, and always use the strategies involved by professionals, and always report it as a matter of urgency to the supervisor or your manager or the professional involved. It is very hard for somebody who has brain injury to deal with stress. And what happens when somebody is dealing with stress? There is a lot of cognitive functions of the brain which are involved, which a lot of people lose because of brain injuries or any other problems. And brain injury cannot, if you're talking about brain injury, it doesn't mean that it is always brain injury by an accident. It can be due to development delays. A lot of brain injuries happen in the hospitals, during procedures. A lot of brain injuries happen, maybe a lack of oxygen, or when somebody drowns. So brain injuries can be through different other factors as well. So always find out what is the reason, and that will help you to understand it. Read about it more and more. And first step to reduce stress is become aware of the major sources which exist in their life. And second step is to look at these resources, that can they be controlled, are they uncontrollable, are they important, or they are not important. And this can help a person from to stand back from the situation, and very clearly and objectively. There can be panic attacks also. So sometimes what happens, you will see that everything is okay, day is going good, and suddenly there will be a panic attack. And then you have to understand the danger involved, and you should be always prompting the person that they should not worry about it, and things are in control, and try to use the strategies involved from your behavior support plan. And panic attacks associated disorders are depression, phobias, and obsessive compulsive disorder. So phobia, I will tell, phobias means different phobias, like water phobia, or could be phobia from rain, anything. So all of us have a different phobia. I have a phobia of snakes. And like OCD is obsessive compulsive. I will give an example that some people, whenever they will go to any place, they would like to see everything in a place, a certain order. So that's OCD. It can be to a large extent or to a small extent. So what are the simple symptoms? Symptoms are elevated anxiety, heart palpitation, hyperventilation, muscle pain, and dizziness, sweating. There is often a fever totally. So it can be sometimes when you are, everybody has experienced a panic attack. Some people feel that kind of symptoms when they go on stage. They have a fear from public, when they are facing a big crowd. So they have a panic attack of facing the crowd and going and leading them. So you would have observed such kind of things. So, but it's also associated to brain injury. And what are the treatments? Cognitive behavioral therapy, medication, complementary therapies, diet and exercise, relaxation techniques, and medication. And what happens to the things like alcohol and the drugs if it's with brain injury? People who already have a dependence on alcohol or other drugs prior to are likely to have an even higher dependence. And others may find for drug use becoming a problem first time as they struggle with many changes faced after acquiring a brain injury. So question is, can people drink alcohol after a brain injury? Studies suggest that alcohol for people with a brain injury can have a negative outcome. So it means they can affect them negatively, take them into different phases of all those which we have already discussed. Most rehabilitation steps recommend that people abstain from alcohol for at least 2 to 3 years while the brain is not permanently. Painkillers are commonly prescribed after a brain injury is highly addictive. So increase the amount of depression that a person has and can make your memory a lot worse after a brain injury. Tramadol should not be used when taking an antidepressant. The combination can produce nasty side effects and make people quite ill. Ask for help. Yes, this is the most important thing. Support is available for those concerned with drinking, using drugs, causing problem for someone they care for. So always ask for problem. There is a lot of organizations available. If you want information, you can email me at the email address or contact me, which is at the end of the slide. So I can provide you all those informations in detail if you want to, but yes, available on Google. Just Google it and you will find it. Take home messages. Mental illness is when a person has a particular symptom behavior that represent certain types of illness that psychiatrists diagnoses. That the most severe a person brain injury, the greater risk they have of getting a mental health problem. Identifying mental health problems after brain injury is very important, and lot of resources available. The New South Wales Brain Injury Association has a lot of material available about it, and we have included a lot of information from here as well from them. Thank you. This is the end of the slide. And for any other information, and if you are an organization having some staff and you want professional training on brain injury and mental health and more detail, so you can contact us on the given email ID and contact. And what I will do, I will once you contact us at a very reasonable rate, we can issue a certificate of attendance and a quiz, and also a training attendance sheet, which will help you in your audit and also will train your staff effectively. And it is and there are the different trainings available. And we also provide online solution for any training you want to provide. We have our team of trainers, so a lot of trainers of RN, and myself, I am also registered trainer. So you can always feel free to contact us. Thank you.